ومن أحسن قولا ممن دعا إلى الله وعمل صالحا وقال إنني من المسلمين.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على رسول الله. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mohammad Suhail. I'm a physician in Dallas. Alhamdulillah, my practice is based in Dallas Presbyterian Hospital. Along with my partner and I, we are involved in multiple projects in the medical field here. We have a primary care clinic and we are participating in hospital medicine. And alhamdulillah, we are also medical directors of several skilled nursing facilities in town, along with hospice facilities and home health. Inshallah, today's presentation is going to be about medical resources for the elderly. Now, even though it says elderly, it really is for all the adults, but as you will soon understand that these services are mostly utilized by people of a certain age group. So inshallah, we'll get started. Now, why is it important for us to talk about these resources? Life expectancy is growing every single year. There are more people in their 70s and 80s now than there were ever before. So as people get older, they have certain medical conditions that they can develop or suffer from, including dementia. They can end up with strokes. Fall risks can go up, causing them to break their hips or joints, resulting in lots of debility. And for these things, they need lots of services to help them get around, to recover, and to get back in a normal shape as much as they can. So inshallah, that's the reason why I picked out this topic and to kind of share the resources we have available in the community. Rasulullah, when he was talking about the good qualities of the Romans or the Westerners, he said one of the good qualities they have is that they do good for the vulnerable people. So in our community, the elderly is one such group that does need a lot of help. And alhamdulillah, we're blessed in this community to have a lot of resources around us. So let's talk about some of these. So what resources are there that are available for them? Number one, there's home health, and I'll go more into detail on all these topics. Next is skilled nursing facilities, which are also known as nursing homes. There's short-term nursing homes and long-term care at a nursing home. There's inpatient rehab, assisted living facilities, independent livings, and in the end we'll talk about physician visits to the home. So what is a skilled nursing facility, or let's say a nursing home? So a nursing home was a term that was commonly used in the past. Nowadays people have kind of gone away from it because of there may be some taboo to it, because in the past people would always think nursing home is a place where when a person gets old, people just leave them there and kind of forget about them. But there's so much more to that in a nursing skill facility. So this skilled nursing facility has a short-term care and a long-term care site. In a short-term care site, you have people that are needing more help than they can get at their own homes. So they need, let's say, IV antibiotics to be administered that are expensive, wound care, they need more physical therapy, some of these things that cannot be achieved at home, and these people simply don't have enough resources at home. They don't have anybody else to take care of them at home, and they need to be in a safe and secure environment, hence the need for the skilled nursing facility. The skilled nursing facility provides you with a nurse that's there with you 24/7. The nurse's job is to make sure to basically complete all the skilled therapy that may be needed. So in terms of pain management, she's the one that's going to give you pain medications. If there's wound care that needs to be taken care of, if there's certain IV medications that need to be given to you, the nurse takes care of that. Also, in the skilled nursing facilities, you have physical therapy. They make you participate in physical therapy 3 to 5 times a day, depending on how much physical therapy you truly need. The physical therapist's job is to make sure they improve your balance, your coordination, your strength. Occupational therapy helps you with activities of daily living, meaning they help you with your grooming habits, your eating habits, and the simple things you do at home that we take for granted that a lot of people may end up losing at an elderly age. Then there's speech therapy that helps people with strokes, with their speech, with their swallowing abilities. And one thing at a skilled nursing facility is that you always have a doctor or a nurse practitioner that can come by and see you if they want to, they can come by and see you 7 days a week, depending on how much care you need. So you have a doctor that comes by and sees you almost on a daily basis. Again, this is a slide that kind of summarizes everything. I just talked about what the nurses do, the physical therapy, speech therapy, so forth and so on. In the bottom, I mentioned here about the pay. Now, all of these facilities, obviously, there is going to be a charge associated with them. We'll talk about how to pay for these facilities and these resources towards the end, but I'm just going to summarize at the end of my slide after I mention each facility. If you're a self-pay patient and you're paying out of pocket, the visit could be between $200 to $250 per day. With the self-pay, you have to pay usually 30 days in advance, and this only covers like your room and board, your meals. Physical therapy and other services may be additional. Now, Medicare Part A will cover your room and board service for up to X amount of days, and after that, you may have to depend on the other supplemental insurance for the remaining visits. The long-term part of the skilled nursing facility. So we just talked the short-term part. Now, short-term part, patients are there for maybe a few days, 2 weeks, till they get stronger, till they complete the required antibiotics or wound care, and they go home. The long-term care are patients that are truly, they don't have help at home. They are very debilitated because of their health conditions, or they may be of just very elderly age and need more help. And these patients can stay at the skilled nursing facility up to months, years, maybe even lifelong, depending on how much care they need. Here, the service that are provided to them, more than physical, some of them do get some physical therapy, but it's mainly occupational therapy where they kind of help them with their toileting skills, their grooming, their bathing, help them eat, things of that nature, give them their medications on time. And really, this is the help that they cannot get at their own homes. Now, how do people pay for this? They can be self-pay, again, the thing I mentioned in the last slide, or Medicaid, not Medicare, but Medicaid will pay for this depending on which facility you go to. A lot of these facilities, by the way, have Medicaid beds that are assigned, a set number of Medicaid beds. So once those fill up, then they don't have any more room. But so really, it's looking at each facility, what they have available, and you go from there. Again, this slide kind of mentions what facilities are available to you at the long-term care, or what they work with the patient. Like I said, eating, bathing, dressing, so forth and so on. Besides this skilled nursing facility, there are other alternatives as well. We'll talk about assisted living facility in a second. There's subsidized senior living. These are housing complexes for the elderly. They make sure that when they build these apartments that the layout of the building and the rooms are such that they are easily accessible and have all the tools that are needed for an elderly set population. And I think they also have set discounted rates for the elderly population. And there are continuing care communities, retirement communities rather, and their job is basically it's a giant community, just like what it says. And they provide you with not only a living facility, but also they may have some entertainment section there. They may have a place of worship for you. They provide you with transportation to go back and forth from stores or groceries, what have you. And it's just a large community. We have a few of those in Dallas as well. And you can type all these up online and look at what options you have available in case you or your loved one are thinking about exploring these options. So what is an assisted living facility? In the assisted living facility, you are more independent and needing less care than you are at a skilled nursing facility. But you still want to make sure that someone keeps an eye on you and someone prepares your meals for you. So the assisted living facility basically gives you more independence. You can leave whenever you want to go outside. You can come back. No one's going to stop you. Whereas a skilled nursing facility, you have certain restrictions. Also in the assisted living facility, you can go visit your own primary care doctor if you want to, or if you want a physician to come on site and see you, that's also an option. Again, they work a lot for the assisted living patients with grooming techniques, bathing, the term I used before, activities of daily living, where they kind of make sure that there's someone available there at all times to help you with the basic things, basic necessities of life that we take granted for now. And also there's a med available at all times to make sure you get your medications on time. And in a lot of places, they do have a nurse available in case there is some kind of emergency that takes place. Also, how does one pay for an assisted living facility? This is not coming out of insurance. Majority of them are coming from self-pay, and they can really vary. It can be pretty expensive from $3,000 to a month to $5,000 to a month. It's really not regulated by the government as to how much they can charge. The nicer the facility, the more you have to pay. There are some facilities that do have Medicaid only rooms, or Medicaid facility where Medicaid pays for it. You just have to do some research on that. There's independent living as well, and it's just like what it says. It's really independent living. You can come in, go out whenever you want to. They prepare meals for you. It's a nice fancy place. Depending on how fancy it is, the more you pay for it. There is no med aids here. There is no nurse here. It's all you living by yourself, but you're living in an apartment, in a sense, in a building that has housing units. They can be very fancy. Again, depends on how much you pay. This is a skilled nursing facility / assisted living facility. Name is Adora, that I really wanted to mention this today. And the reason being, it's only 8 minutes from INT. It's state-of-the-art facility. It was built in 2018. I'm actually the medical director of this facility. And alhamdulillah, what we've been able to do is we've been able to partner with Irving Masjid. And this facility, if we have enough Muslim patients, they're allowing us to even do Jummah khutbahs. We also have halal food here. And in case you're wondering, yes, it's hand-cut zabiha. There's no other option for us, inshallah. So we will be, so we have that there, and the address is at the bottom, along with the telephone number. So in case you're wondering, is there any facilities for the Muslim people? Yes, Adora, alhamdulillah, is a great option, and it's in Richardson. The next is home health services. Now, what is the purpose of this? People that have someone at home to take care of them, to help them, but they still need a little bit more help. So they can have a nurse come by to their homes to help them with their antibiotics, or their medications, their wound care, their rehab. So they're not sick enough to go to a facility, but they still need some extra help. This is where home health is great at. It's a good continuum of healthcare. That way you don't have to necessarily go to a facility. You can stay at home and get all the support you need. The other things I just wanted to highlight, for people that are by themselves and they may not be able to cook and have difficulty with preparing their meals, there is an agency in Dallas called Meals on Wheels. It is, again, a home health type agency where they prepare meals for you 3 times a day, 7 days a week. And as long as you are disabled due to any mental or physical condition and you are confined to indoors, they will come deliver the meals to you if you get qualified for the service. Unfortunately, in Dallas, they don't have halal meals provided by Meals on Wheels, but there is in Irving, there is a place called Loukmeh, Loukmeh. It's on my slide. They do meal preps. They will deliver it to your homes, and there's also pickup locations. So in case you're having difficulty preparing your own meals, you can call in, order, just look it up online, and they have a whole system of how you can do weekly meals or order in advance, and they will have the meals ready for you. But by the way, that is not a health agency by any chance. I was just mentioning it as I came along, as it came up in my research. The hospice, I know my cousin, Dr. Salman Rahim, he did a great presentation last week, and he talked about hospice. I'm not going to go to detail. All I'm going to say is that hospice is really something that can improve the quality of life for someone that may be terminal or maybe going through an end-stage disease. But hospice can be done at a skilled nursing facility, or it can also be at home. Both options are open. At home, the insurances will pay for it. It could be Medicare, could be private pay, or your supplemental insurance. At a skilled nursing facility, Medicare Part A will pay for the room and board, and then some of the medications and stuff maybe have to coming out of supplemental insurance. Now, how does one qualify for the services? So what are the scenarios that you can get into the skilled nursing facility or home health? So scenario A is basically you get sick from a certain health condition. Maybe you get pneumonia or stroke, God forbid, or something of that, or something serious. And you end up going to the hospital, and at the hospital you have a prolonged stay. You're staying there for several days, and now you progress to get a little bit weaker. And physical therapy comes by and sees you and says, okay, you need a little bit more help, or you need some more IV antibiotics to be administered, or you need some extra help. And this is where you may get qualified to go to a skilled nursing facility. Again, they'll come back to your insurance. Once the insurance approves, you get to go to the skilled nursing facility, or if you have enough help, like I said earlier, you get to go home with home health. Now, you could be at home, and this is scenario B, is where you are at home, but because of advanced age, maybe there's some dementia kicking in, or you're just getting weaker and falling more frequently, and you need more help. In this case, you go to your primary care provider, you let him know what's happening. The primary care provider can write a note up and send this information and work with the home health agencies or skilled nursing facilities and send an order saying that my patient needs skilled nursing needs or home health. And once insurance approves, you can go to the facility. Now, if it's self-pay, obviously you don't need to go through any insurance. You'll get approved right away. And those are the two scenarios that you can get qualified for, the skilled nursing or home health. And there are certain resources available at home I just want you to be aware of. I know with COVID, a lot of people are not wanting to go out of their homes. So there is a concierge service of physicians where they come to your home and see you. I do some concierge service as well, where I go to patients' home and see them personally. This way they don't ever have to leave their home. We also have lab companies that come by to your home and do the lab work. You don't have to go to a lab and do it. And like I said, home health. Again, home health is not only just regular nursing, but physical and occupational therapy. Everything we mentioned earlier, they also can come to your home, like I said earlier, and see you at your home. The other thing I want to mention is how you go about paying for these services. So there's really 4 methods of doing it. Number 1 is going to be self-pay, and that's pretty easy. You don't have insurance. You can pay out of pocket. There's usually an upfront cost. You have to pay 30 days upfront for some of these services, and then as that's decided and you pay upfront, you get qualified and you move on. That's option 1. Option 2 is you have your own private insurance, where as long as you're paying your deductibles and out-of-pocket costs, then the insurance will pick up the tab on all of these things. Option 3 and 4 we'll talk are Medicaid and Medicare. So Medicaid is really a couple ways to get Medicaid. The most important thing is they're going to look at your income and how much income you're making on a yearly basis to see if you get qualified for Medicaid. On top of that, you have to have certain medical conditions, either be pregnant, you have disability of some kind, you're blind, and there's other things, and you can look this up at medicaid.gov. And once you meet the criteria, you can sign up for Medicaid, and that will help pay for some of these facilities. And last is Medicare. Now, Medicare comes with 4 parts, Part A, B, C, and D. Part A, the way you qualify, there's a few ways on there. Also, you can look this up at medicare.gov. For Part A, you turn 65 years of age, and you've given at least 10 years of income to Social Security. And if you do that, you get automatically qualified for Medicare when you turn at the age of 65. The second way is you are less than the age of 65, but you've had some kind of disability. And 2 years after the disability, you get qualified to get Medicare Part A. And third is you have some kidney problems and you get put on dialysis and you can immediately get Medicare. There are other medical conditions such as ALS. You can look this up at medicare.gov and they'll tell you about it. Now, what does Medicare Part A cover? The Medicare Part A covers your hospital visit. So if you go to a hospital, you had surgery or any kind of expenses, lab tests, imagings, Medicare Part A covers all of that. One thing it does not cover is physician charges. So the daily physician visits or any work the physician does on you, his or her pay is not covered in Medicare Part A. Where does that covered? It gets covered in Medicare Part B. Medicare Part B is something you have to sign up for. It's not automatic. As of 2020, it's $144.60 per month, and Part B covers physician visits, and if you're at a skilled nursing facility, it covers your therapy charges as well. Again, if there's questions, you can go to this website that I have listed down here, MedicareMadeClear.com. It will answer all your questions. Medicare Part D, it helps you, D stands for drugs, helps you with your prescriptions, and there's a set plan. I think the most deductible I've seen is $435. And there are many options out there. You can just go on Medicare.gov or MedicareClear.com, and that will tell you the options. And the last is Medicare Part C. It's really a Medicare supplemental plan. You have to have Part A and Part B. Part A and Part B don't cover every single thing. Hence, you need this plan, especially if you have a lot of comorbid conditions and you have frequently visited the hospital. This will kind of cover everything that Part A and Part B does not cover. There's, again, out of hospital costs here, and there's some deductibles, but it's fairly straightforward. And you have to enroll through this to a private healthcare plan. I think that pretty much summarizes everything I had to say. Before you sign up with any of these facilities or skilled nursing facilities or home health, make sure you reach out to the social workers or the managers of the hospice and the home health companies in case you have any questions. That way you are clear as to what the costs are going to be, what the insurances are covering. That way you're not surprised by the bill and the end of it. If you have any questions, please email me at suhailmed@gmail.com. My email is on the site. And Jazakallah khair for listening. Assalamu alaikum wa rahmatullahi wa barakatuh.
إن المسلمين والمسلمات والمؤمنين والمؤمنات والقانتين والقانتات والصادقين والصادقات والصابرين والصابرات والخاشعين والخاشعات والمتصدقين والمتصدقات والصائمين والصائمات والحافظين فروجهم والحافظات والذاكرين الله كثيرا والذاكرات أعد الله لهم مغفرة وأجرا عظيما.